my name is Elizabeth Connell. I will be graduating from the University of North Texas this December with a major in audiology and speech-language pathology and a minor in applied behavior analysis. I will be graduating magna cum laude with a cumulative GPA of a 3.85. I am so excited and honored to be applying at Texas Women's University's Master's Program of Communication Sciences and Disorders. I told myself I was not going to be biased, but this is my top choice of a graduate school. It holds a really special place in my heart because my mom was a graduate student at TWU. So I wanted to make this video to introduce myself to y'all, to share my background, and to give you my heart for speech-language pathology. So I currently live and commute in Grapevine, Texas. I live with my mom and my two little sisters, Rachel and Katie, and my crazy golden retriever. That's actually his picture. His name is Tucker. This is such a blessing because it is in the middle of the Denton and the Dallas TWU campus. When I was 13 years old, my parents divorced. My dad was diagnosed with a personality disorder, actually a narcissistic personality disorder, and was verbally, mentally, and emotionally abusive to my family. During this time, my mom actually went back to graduate school and got her Master's of Arts in Teaching. And as a dyslexia therapist, this just modeled for me and showed me how important an education is in a graduate degree. And because of this, I really want to higher my education and continue with the field of speech-language pathology. So I am no longer in contact with my dad. He does not help or support me in any of my colleges, and from the support of my family and working 2 jobs, I am in no debt, and I've not taken out any loans for my undergraduate degree, so I'm so excited. So during this really hard time in my life, I started volunteering in this organization called Helping Our Peers Excel. I'd give up an elective as a middle schooler, which is a big deal, and I would help a student with special needs and a disability. And I had a girl named Stacy, and she had autism. I'd work on social communication skills with her and life skills, and this just sparked a love of working with speech. I've never worked with speech before, and just working with people with a disability. So I continued to do this throughout middle school and high school. I got a job at Gateway Church where I work in the special needs ministry. I work with children from 1 to 13 with all disabilities such as Angelman syndrome, autism, Down syndrome, cerebral palsy, spinal bifida, and I just love it. So during this time, especially my sophomore year of high school, I started to research and I found the field of SLP. And I observed some speech-language pathologists. One of them was a former graduate student here, Dara Boxberger, and she's been so encouraging and supportive to me. And I observed some other speech-language pathologists in a clinical setting, a hospital setting, and a school setting, and this just solidified my love for it. So I got accepted into UNT and started the program and just fell in love and continued to volunteer and shadow some SLPs. I got a job at the UNT Kristen Farmer Autism Center. This is an autism center where I work with children from 1 to have a client that is 15 years old, and I help them on all different life skills, communication skills, educational activities, schoolwork, and I just love it there. One of my clients actually was diagnosed with childhood apraxia speech and autism spectrum disorder. And so that's been really interesting to work with. I am very familiar with different AAC devices and programs such as Proloquo to Go, using iPads, using PEG system, sign language. I actually took over 2 years at UNT of sign language. And just working on my communication skills and literally applying the knowledge and the tools I've learned in my classes to this clinical setting. And it's helped my therapy sessions tremendously. Another really cool experience I had at UNT was my professor, Stacy Nunley, asked me to volunteer at the UNT Aphasia Support Group where I'd work with adults who had aphasia from a stroke or a traumatic brain injury. And these clients were aged from 21 to 75, and we'd meet once a month at a restaurant in Denton and have a quick little therapy session to talk about tips and strategies they can use and tools and just be a support system for them. And I actually got to lead it, and I was so honored, and I just love working with aphasia patients now. So the last thing I want to mention is that I had the opportunity to go to TWU's open house, and I loved it. I got to talk to Mrs. Moore, and she was so kind to let me come even though it was full, and I'm so grateful for that. I got to see Dr. Armstrong, and I didn't get to introduce myself. I'm so sorry because she had to run to a meeting. And I got a long talk with Mrs. Avalera about the Stroke Center in Dallas, which I'm really excited about, and the different clinical opportunities. I am so thankful to have met the faculty and staff, seen the Texas Women's University's campus, and to see the clinic. I can tell how supportive and passionate Everyone is for the field of speech-language pathology and serving others, and I want to be a part of this family. Thank you so much for listening to my video and reading my application. It is an honor to apply here. Thank you.